we are discussing vital signs. First we are seeing definition of vital signs. What is vital signs? Vital signs defined as the signs which should be looked at in total or checked to monitor the function in the body. Vital signs means important signs of our body. So we are checking in total of body and monitor the function of body, how it is functioning. So vital signs also known as cardinal signs. Vital signs also known as cardinal signs. It includes what it is include. First it is body temperature, next pulse, next respiration, next BP, next oxygen saturation and pain. See, now we are seeing when to assess vital signs, when we are checking vital signs. First, on admission to healthcare faculty for the purpose of baseline data. First, on the admission time, when we are taking admission in hospital, then according to their healthcare faculty and baseline data, they want their biodata for that they are checking on admission time. Next, second, when a client has changed his health status or report symptoms concerning health. If after admission, if client health status changing, we are checking the vital signs or report symptoms, any report health are concerning, that time we are checking vital signs. Next, third, pre and post operatively, before and after surgery, we are checking patient vital signs. Next, fourth, before and after administration of medication. If we are giving medication, before also we are checking patient vitals and after also we are checking patient vitals. Next, fifth, before and after nursing intervention. Before nursing intervention and after nursing intervention also we are checking vital signs. So now we are seeing temperature. First we are seeing temperature, definition of the temperature and physiology concept of temperature, and we are seeing sites of temperature, types of temperature. Okay. So first we are seeing temperature. Temperature, heat produced minus heat loss equal to body temperature. So temperature definition, what it is telling, body temperature is balance between heat produced in the body and heat loss from the body. How much heat produced in our body and how much heat losses in the body, that balance between that we are calling body temperature. Okay. Now we are seeing physiology concept of body temperature. Two kind of physiology concept having in our body temperature. What is two concept? First, core temperature, next surface temperature. Core temperature, it is temperature of deeper tissue, internal temperature of our body, core temperature. Surface temperature is the outer part of temperature of our skin. So temperature of skin, subcutaneous tissue and fat. So surface temperature, it is taking temperature of the skin, subcutaneous tissue and fat. So according to environmental temperature, it will rise and it will increasing the temperature and it will fall down the temperature. So now we are discussing about thermometer. What is thermometer? The thermometer, it is most commonly used to the measure body temperature. Body temperature. For that we are using thermometer. Next, it having two parts, bulb and steam. First we are saying bulb. What is bulb? Bulb contains mercury which expanded when exposed to heat rise in steam. So bulb what? Bulb contains mercury. Mercury when heat are produced, that time it is increasing and rise, and it is going rise to in the steam. Next, steam. What is steam? In celebrated in degree, steam is celebrated in degree of Celsius and Fahrenheit. So steam what is? It is a celebrated in degree and Fahrenheit. After that we can calculate how much degree and Celsius having the temperature. Next we are seeing thermometer, figure of the thermometer. So thermometer having, first we are seeing mercury tube, front side see mercury tube having, next having bulb. So bulb, before we are seeing bulb, it contains mercury and expanded to heat rise in the steam. Next, this portion we are calling steam. See, this portion we are calling steam, full this up to this. Next, column of mercury. It's having so many columns, so we are calling column of mercury. This one. Next, having last scale lines. In scale, in thermometer having scale line. Next, having glass tube. Last part we are calling glass tube. See now types of thermometer. 4 types of thermometer having. So first is the clinical thermometer. Second, electronic thermometer. Third is the disposable thermometer. Fourth, tympanic membrane of thermometer. So see types of thermometer. First types we are seeing. First is the, before we are seeing clinical thermometer. About clinical thermometer we are seeing. So what is clinical thermometer? Clinical thermometer is a special instrument designed to measure the temperature of the body. So it is a special instrument which can be designed to measure in our body temperature. So it having advantages and disadvantages. First we are seeing advantages. What are advantages having in clinical thermometer? First, it is low price. Next, it can be easily we are getting. So it is low price. Next, while availability, availability is more. Next, having reliable accuracy, it can give a correct measure. Disadvantages having, so first disadvantages of clinical thermometer: delay time for recording. It is given delay recording. Next, having easily breakable, it can easily broke. Types of thermometer. Second one, electronic thermometer. So now we are seeing electronic thermometer. What it is? It consists of a battery power and display unit, a thin wire cord and a temperature sensitive probe covered by a display plastic to prevent transmission of infection, and separate probe are available for oral and rectal insertion. So what electronic thermometer consists? Battery power with the display unit, it is a thin wire cord connecting, and temperature sensitive probe. Probe means it will examination of our temperature sensitive. Next, cover by the display plastic to prevent transmission of infection. So it having plastic, disposable plastic, it will cover. For that, it will prevent transmission of infection. It will separate examination are available for oral we can did or and rectal insertion we can did. Clinical thermometer, it can provide the temperature. See electronic thermometer. This thermometer can provide a temperature reading in just 2 to 60 seconds. Into the 2 to 60 seconds, we can take the electronic thermometer measurement. See, next third types of thermometer. Third one is disposable thermometer. It is a single use thermometer. So one time we can use this thermometer. Mode of thin plastic strip. It mode having with thin plastic strip chemically impregnated paper, that is infused or substitute with chemical paper. They are used for children to take oral and axillary temperature. This disposable thermometer we are used for children for orally and axillary temperature we are taking. So oral means in mouth we are taking temperature, and axillary means armpit we are taking temperature. See last type of thermometer, that is tympanic membrane thermometer. Tympanic membrane thermometer, it is taking outer temperature of the body, not in core temperature of the body. So tympanic membrane thermometer, these are small handheld device similar to otoscope with disposable thermometer. It is one small handheld device that we can catch in hand. So similar to otoscope with disposable thermometer, otoscope we are mostly checking skin and forehead of the part with disposable thermometer.